Morning, everyone. Firstly, I'd like to acknowledge the traditional owners of the land and elders past and present. It's my great pleasure to be here this morning. I love this conference, as I said last night, to talk about the new sexual health competency standards for primary healthcare nurses. So I'll quickly cover the work that we've done with APNA in the past, why we work with primary healthcare nurses, why we've chosen to work with competencies, what's in the competencies and what we're going to do next. The New South Wales STI Programs Unit, or STIPU as we sort of prefer to be called, has worked with APNA since the first conference in 2009. We value working in partnership with APNA and ASHM on all of our work. And we started our journey, as you can see there, sailing the 7 seas of chlamydia. We then took the golden opportunity to launch the first online STI and blood-borne virus training for primary healthcare nurses on the APNA website. In 2011, we set great expectations in Sydney, and as some may remember, especially with the entertainment. I had to put that in. Last year, it was time to shine, and we talked about how to bolster nurses' capacity to deliver sexual health care, including, as some say, opening the can of worms of STI testing. With our partners, we also awarded the first Sexual Health Best Practice Award to Sandy Anderson for her work with Aboriginal women, and last night awarded David Yuds for his work with HIV and STIs in his population. So this year I'm happy to say we're continuing our work with primary healthcare nurses and APNA. So primary healthcare nurses are well placed to provide screening for asymptomatic patients for STIs, and since many of the STIs, including chlamydia, are asymptomatic, this will help increase testing and treatment and in turn reduce the burden of STIs in the community. Nurses are good at maintaining confidentiality. They create comfortable environments to facilitate an STI consult. They use a non-judgmental approach and pick up on patient cues. And as someone said to me the other day, they've got a lot of common sense, and I like that one as well. Patients also tell nurses things they might not tell the doctor. Chlamydia continues to rise across Australia. The more we test for, the more we continue to find. And with the majority of STI testing taking place in general practice, we need to keep looking and screening for chlamydia. The highest rates for chlamydia are in the 15 to 29-year-old age group. So what does this data tell us? The chlamydia data informs clinical practice by assisting us to target those most at risk of this asymptomatic STI, both for testing, treatment, education and health promotion. The data also supports us to provide a holistic approach to patient care. When people come from a variety of target groups to your practice, you can include it in travel vaccination consults and contraceptive consults. The data also informs clinical guidelines. The latest edition of the Red Book, the 8th edition, reflects the changing epidemiology and supports general practice in the management of STIs by including all sexually active people under between the ages of 15 to 29 years to be tested for chlamydia. It also advises to test anyone who comes in that's asking for an STI test, and I think we need to remember that, it's important. Competency standards articulate the recommended levels of knowledge and provide context-specific tools. They are widely used within nursing and other health professions with the aim to ensure a high level of patient care. So what is assessment and competence? Assessment is defined as a systematic procedure for collecting qualitative and quantitative data to describe progress and ascertain deviations from expected outcomes and achievements. Competence is a core component of nursing practice and is defined as a combination of skills, knowledge, attitudes, values and abilities that underpin effective performance as a nurse. Competence, when assessing competence, it's agreed that more than one indicator of assessment should be used, and for the purpose of this talk, I'll just focus on peer review and self-assessment. Other indicators might include setting professional goals, reflecting on practice, and participation in continuing professional development activities. The sexual health competency standards that we're launching today can be used in all of these situations. The aims of peer review are to foster professional growth and accountability. They provide a medium for sharing experiences. More than one method should be used, and it includes a combination of direct observation, self-reflection and audits. And as an example, direct observation has the ability to change practice. The success of peer review relies on giving clear standards and expectations for all the nurses involved in peer review before starting the review. Self-assessment has been reported as the most common form of competence assessment. Self-reflection is a common starting point for self-assessment, peer review and other forms of assessment. Nurses may need support and opportunities to reflect on practice in meaningful ways, and assistance can be provided by an informal supervisor or a colleague. We need to remember, though, that it's important for managers to ensure there's opportunities for this time for non-clinical reflection because we're all so busy. So the new sexual health competencies aim to articulate the scope of practice, formally communicate how these skills and attributes contribute to interdisciplinary care and support practice in sexual health and reproductive care. The sexual health competency standards for primary healthcare nurses have been adapted from the ASHHNA competency standards, that's the blue one in the middle. These were based on the ANF standards for nursing in general practice. The new competency standards support nursing practice in sexual and reproductive health care, including STI testing within general practice setting, and have been reviewed for appropriateness and acceptability by the Primary Healthcare Nurses Special Interest Group and APNA. Our aim was to provide a practical tool that could be used by individuals, managers and supervisors to define and assess practice. The competency standards contain a brief background, the primary healthcare nursing scope of practice, follow-up for patients that's diagnosed with an STI, assessing competence, the key practice skills that will be gained, the 7 domains, and continuing professional development portfolio. These are the 7 domains: effective communication, assessment, care planning and clinical management, health promotion and client education, research, legal and ethical nursing practice, collaborative care and partnerships, leadership and development of the specialty. If we look at Domain 1 as an example, effective communication, the asterisk on the right-hand side denotes that peer assessment is required for explaining confidentiality and privacy policies relevant to patient care. While these are not unique to sexual health care, they are important as these are key concerns for patients when undertaking STI testing. To give you an example, Domain 2, assessment, care planning and clinical management, accurately obtaining specimens with minimal discomfort to the patient are key, and the majority of STI specimens can actually be self-collected. So this competency ensures that the nurse has an understanding of collection methods for these samples. The key practice skills that the sexual health competencies will focus on include sexual history taking, specimen collection, information provision, contact tracing, and advocating for sexual health in the nursing practice. The competencies can also be used as a professional framework against which to measure performance. They can be used to advocate for sexual health care to be included within the role of nurses in primary care, provide guidelines for best practice for primary healthcare nurses, assist in identifying areas of practice where further training and ongoing professional development are required, assist in the documentation of the professional development achievements and plans, inform employers such as general practitioners of the level of sexual healthcare expertise that primary healthcare nurses can provide to patients attending their general practice. They can also demonstrate continuing competence and be added to your professional portfolio. And as an example, on Thursday we ran the first sexual health nursing course with ASHHNA at the conference, and we utilised these competencies to develop the course, but also there was a session in there that enabled the nurses to be assessed on their competence. So they sat with a sexual health specialist and was assessed on that peer review assessment. So there's now 14 nurses in the crowd that have been assessed on those. So what will we do next? We will work with the primary healthcare nurses the special interest group that we've got together to work on like an online interactive site that supports the competencies and the use of the competencies. We'll also evaluate the acceptability of the competencies and their use in the local setting. We're keen to develop clinical placement guidelines at sexual health clinics for nurses, and also run some more face-to-face training. We already do that for general practitioners, so our aim is to do that for practice nurses as well. And finally, we will develop sexual health guidelines specific to nurses working in primary care. It's my pleasure to launch the first edition of the Sexual Health Competency Standards for primary healthcare nurses. I would like to acknowledge all the work of the nurses on the special interest group, as well as our partners on the screen. Thank you.